generations. Even at one time, and I'm sure many of the baby boomers will remember this, you go into a baby's room and above the crib there'd be pest strips, and those were loaded with pesticides. You thought, this is good. It's trapping the flies so they don't land on the baby. No one told you that they were outgassing. People would spray their lawns all over the place, never thinking that this could be toxic. I remember when Adele Davis developed her cancer, and we were on a tour with our separate publishers, but we were on the same tour. And we had a long opportunity for talking, and she was this wonderfully soothing, very positive woman who was enormously influential because the average American just associated with her. She looked like and sounded like everyone's good grandmother, the grandmother that everybody wants. And she looked that way too. She was overweight and very positive. She had a background in nursing. But then she developed cancer, and it's the cancer that would kill her. And she told me, she said, I know exactly how I got this cancer. And I said, how? She said there was a period of time when they were doing all this spraying around my house, and I could smell that. I started to get sick, and I closed the windows, but it was too late. And for days I was breathing all this in. And at that time, by the way, we did not have all the knowledge we have now about the dangers of pesticides. People don't know that story, but that's an actual reason she believes she developed cancer. This comes from the University of Granada in Spain. It was published in the peer-reviewed journal Environmental Research. Quote, environmental health scientists have discovered a link between type 2 diabetes and pesticides. The results could explain the significant increase in health conditions in the last few years. The investigators found people with higher concentrations of DDE, a pesticide, are 400% more likely to develop type 2 diabetes. Additionally, exposure to a chemical found in the common pesticide lindano also increased the risk of developing diabetes. Quote, the mechanisms of actions by which chemicals increase the risk of diabetes is unknown. However, some researchers have suggested pesticides might cause an immunological response when they penetrate estrogen receptors in tissues associated with metabolism of sugars, end quote. One more reason that you shouldn't be using any artificial pesticides at all, not around your home. And for those of you who live on golf courses, whoa, just be aware of this. Yes, there's lots of advantages living in a gated community out in Arizona or in West Palm Beach or Fort Myers or Naples or all the other places. The numbers are staggering. I have two sets of numbers. One shows 17 million Americans living in gated communities. Another shows upwards of 30 million Americans living in gated communities. And they generally have golf courses and tennis clubs and restaurants and lots of social activities. And for a lot of people, a safe, wholesome environment where their favorite hobby is readily available and they can engage in it and have neighbors of a similar mindset. I can certainly appreciate the importance of that. However, understand this. More pesticides are sprayed on golf courses than any other area of non-commercial use land. So you're getting an enormous amount of pesticide in the air, and it doesn't go away. So my suggestion, get yourself a pesticide or heavy metal blood workup, hair workup, and see how much you have in your body, because that can lead to cancer. And finally, proper eating improves dementia and physical and mental health. Now, this is from mainstream medicine. This is reported in Medical News Today and published in the peer-reviewed journal, the Journal of Advanced Nursing. And here's what it says, quote, dementia patients who are given an educational program to help them remember proper eating habits not only improve their physical health, but their mental health as well. The patients who receive the intervention are less likely to show depressive symptoms half a year later. Well, that's good. Now let me tell you something better. Recently, I had to do an intervention. I was asked to do an intervention with someone I've known for a long time and who has not lived a healthy life and had hit rock bottom. But what concerned the family, and the father and mother in particular, was dementia. Saying the same thing 5 or 10 times in a row, just one after the other, but not remembering that they had just said the same thing. And the father was just overwhelmed with fear that his son would become like his wife, who has Alzheimer's. And he, in his mid-80s, is having to take care of his wife. And that's an enormous challenge. And he said the psychiatrists say there's nothing done, the neurologists say nothing can be done, we put on some meds, but it's inevitable that this is going to happen. You've known him for a long time, you've been a friend, can you help him? I said, sure. So I took some time from my filming, and I worked with him day and night. And the good news is, in only 18 days, he no longer is repeating himself at all. And before, he wouldn't remember a single thing you said 10 minutes after you said it. Now he can remember complete conversations from a day before and is making improvement. So now he is with his parents, with a protocol, and another friend who is going to be there working with him each day. So when I hear good news from mainstream science that they're able to help dementia patients, it's all relative. They think it's great if they simply slow down the progression of disease. I believe it's great news when we reverse the disease. We know how to reverse brain damage. We know how to help people reverse diseases that science simply says is not possible. But just like with AIDS, they're doing all this worldwide publicity, headlines everywhere, about a baby that they think no longer has HIV or AIDS. They're not sure because they have none of the blood work up from the mother originally, and they're just flying in the wind. I'll tell you why it's all so stupid. But when they had a chance for 5 years, 20 hours a day, 7 days a week, to come and sit and talk with people with advanced AIDS who are being cared for by a team of 24 medical staff at my center in New York, and all the protocols were my protocols. I was there every day. I was there 18 hours a day, if you remember. And these were people who were at death's door coming in and filled with life and improvement going out, and 12 of them who decided to be on an advanced protocol, which was extremely rigorous. It required them to get therapy 6 days a week, 5 hours a day. That's a lot of time to be in therapy, but they did it. All 12 reversed their HIV and AIDS completely and stayed HIV and disease-free and were in optimal health. Their medical records, the physicians, all were there. Went on Tony Brown's journal. He had his medical team review it all before they came on. Medical records, blood workups, everything. Not a single member of the American media dared touch that story, dared to come to the press conference where 100 of these improved people, not just my 12 people were there, but another 88 people from around the United States were there with their physicians and medical records. Not a single member of the American media wanted to come. To me, that showed the total, complete fraud of everything in the AIDS establishment, from the gay activists who were shilling and pimping for big pharma so they get their grants and let me in the door, to the pharmacists who would have an unlimited income, the professors, the scientists for hire. Everybody started feeding at that trough and wasting lives, causing innumerable people to die who wouldn't have had to. On the other end, we were saving lives. You wouldn't know that because that's not how we face reality in our society. Now, I did mention that a high iron intake may help protect against PMS. A little more on that. According to the latest in research at University of Massachusetts, Amherst, and Harvard, a study that looked at 3,000 women and followed them over 10 years, quote, we found that women who consume the most non-heme iron, the form primarily in plant foods and in supplements, had a 40% lower risk of developing PMS than women who consumed the lowest amount of non-heme iron. That's good. That's excellent. That was published in the American Journal of Epidemiology. So what's the takeaway message here? The takeaway message is when you're doing a glass of juice and you're using your celery and broccoli and kale and parsley and cabbage, you're getting your non-animal heme. You're getting the good ferrous fumarate. You're getting the one that doesn't promote heart disease. You're getting the healthy form of iron and enriching your blood, and that's all to the good. Back in a moment. Please stay with us.